All right, y'all. We are live. We are alive and well and kicking. Welcome back to the BirthFit podcast. This is episode number 242. And as I said earlier on my Instagram stories, we have Dr. Neel B. I'll let him say his last name so I don't butcher it. But the cool thing here is he is so well versed, has so much experience. God's gifts, really. That's what we say behind the scenes at BirthFit with airway specialist, feeding specialist, kind of the whole fascial integration system of the body. And before I, go on with words and rambling and word salads, I will let him introduce himself. But before I do that, let me just give y'all a few announcements. Right now, we just came back from the July 4th break. We wrapped up our Mama Move Challenge. We wrapped up our BirthFit Basics Postpartum Challenge in May. And we're taking July kind of slow is fast. And we're going to get back into things in August. So make sure you're on our newsletter because, hint, hint, we've got a really cool, dare I say, app situation coming. So stay tuned for that. And we have a new little challenge that's coming in September. That's all the announcements I have. Let's go. Dr. Neel, welcome to the BirthFit podcast. We've been excited to get you on. I know we've played scheduling tag and all the things, but you made it. I made it. We're here. So introduce yourself, say your last name for everybody, and maybe spell it in case they want to look you up. And be sure to tell people right away, I like for people to do this right away, where they can find you, like your Instagram, social media, website, all that stuff, whatever you want to put out there.
Yeah, thank you. Well, first of all, I'm so excited to talk with you. I feel like we've had the dance of you all have a lot going on. I mean, there was a baby born in the process. I mean, you already had your baby. Well, no, we were talking anyways. I just feel like this has been so much good anticipation towards this moment. So I'm really just so happy to get into a space of hanging out with you, first of all.
Yeah.
And then, yeah, I'm so excited to talk. And right away, I'll say the main place I'm at is Instagram, Dr. Neel Bulchandani. Bulchandani is how you say my last name. Bulchandani is usually
like it's spelled.
Slowed down. Yeah, it's like it's spelled. My mom and dad are from India, born in India. So they might say Bulchandani, but I don't say that. I say Bulchandani. So that's easy. At least it looks like that to me. So, but my Instagram handle is, Dr. Neel Bulchandani, Neel, and then Bulchandani that's just Instagram. And then I have a podcast on a YouTube channel called Compromise to Alchemized. I'm merging the embryology podcast, embodied embryology podcast that I've been doing for a while into that. And then, I'm an integrative airway and feeding chiropractor, which is a specialty I created. And I that's my jam. I love birth, prenatal, fertility, pregnancy, postpartum, infant care, family care, nervous system care. I know those are the buzzwords that we need to know about. So I love taking care of families, and I love to get to do the work that I do. Now, physically, where I'm at right now is in the Bay Area, where I come once a month to work and collaborate with Dr. Zagi, who's an ENT specialist in tongue-tie airway. But he's based in Beverly Hills. So next week I'll be in LA doing collaborative work with his institute, the Breathe Institute, where he's based both in Beverly Hills and Calabasas. So I'll be hanging out down there, seeing patients there for a little bit. And then my home base is in Redding, so up at the top of the state. So I just go from top to bottom now, which is pretty cool.
You cover some ground.
Yeah.
So, okay, hold on. What address is he at in Beverly Hills? Because I used to I started way long time ago as a chiropractor renting space in Beverly Hills.
Oh, no way.
Yeah.
You were in Beverly Hills?
Yeah, for a hot second.
Oh my gosh.
Yeah.
Well, he's in Westwood, and he's on Wilshire Boulevard.
Okay.
So he's
right in there.
Yeah, it can't be
far. That's funny. Yeah, I was on Camden Boulevard. I
Okay.
rented space. Yeah.
Oh, wow.
Um, it was a wild time, and I rented space from a plastic surgeon. So a chiropractor there was kind of like random,
Yeah.
and it was right as in the origins of BirthFit. So I was making it work, making all the things work. But I want to know, how the heck did you go down this niche path? Because, in chiropractic school, I don't know where you went to chiropractic school, but where I went to chiropractic school, not the greatest or straightest of chiropractic schools, but we definitely didn't get feeding, airway, stuff like that. And so it's something I know you've had to learn beyond school. So how did that start? Where did you get into it? And yeah, do you train other chiropractors
Yes.
or
Yeah. Yeah.
other practitioners?
Yeah, I do. I do. Yeah. So, no, it was the rabbit hole of
Yeah.
anybody's gone down well, there's so many rabbit holes to go down. So, um, I went to Palmer Chiropractic College.
Nice.
So that was the place I went. I'm from Illinois. So I just went a few hours
You
over to
went to the one in the Bay Area?
Davenport.
Yeah.
I
Oh,
was born and raised
Davenport.
in
Okay.
Illinois. So I went to the mothership.
Dang.
Head. Yeah, so I knew Tony Ebo from we've talked every once in a while. So he was in the class right above me, like a trimester ahead of me.
Wow.
So I met him in Motion Palpation Club.
Ah,
He helped me do some setups. I was in the Gonstead Club. We were both like unofficially like, you do that, I do this. But
yeah,
when you graduate, you're like, you know what? It's just about healing, helping heal people, not about clubs.
totally.
Um, so um, so I started there, and when I graduated, I I mean I already felt like when people came in, whatever I learned in chiropractic college was a good foundation, and I think this is
Yeah.
what a lot of people find. But I just started to feel like with my fingers and started to sense into people's bodies and getting words of knowledge, working empathically. That is how I work. So I just feel
Mm.
what people feel, and I feel where they're misaligned, and I can see the patterns on their bodies. So much of what I've done has come through downloads and through being in front of somebody, and if it's a baby or an adult, and I can feel their kidney go out of alignment. Well, I know that's why I need to work on that. I feel it on their
Mm.
bodies to confirm what I'm feeling in my body,
Yeah.
but it's to confirm that. Um, so that being said, I think there's like one case where somebody came in with a concussion, and he was brought in by his friend, and he was thrown off his quad, and he was just dazed. I mean, he couldn't move his legs because his brain wouldn't talk to his legs. He came in with his head bandaged up. And I just remember this was when I moved to Reading, so that was a year and a half after I graduated chiropractic college. And so I graduated in 2008. And then by 2010, I was in Reading, California. And I remember when this guy, Mark, his friend brought him in, he, um, I was working on him, and then I just started to feel my hands go towards areas of his body, his cranials,
Mm.
his visceral system, his organs. And by the time I went through those patterns and released things, he was running in place, and he was smiling, and he was laughing.
Oh,
And that was a good
smiling.
entry point for me into, okay, I know what I've learned, but now intuition is becoming my greatest teacher. And so I think that was
That's
the
cool.
beginning of like why I started to go down this path. But the airway feeding path was a really different rabbit hole in that we had our first child in 2016, and she was born at home in a birth pool, like the other two were after that. But our midwife said, "You know what? Your daughter has a tongue tie," and we're like, "What's that?" I didn't even
Yeah.
know what it was at the time. And the story is long. I've written about it. It's on my
Cool.
Substack. I've written
Yeah.
about pregnancy, grief, pregnancy, miscarriage, and grief because the one we had before that didn't make it. But we went through this journey of what is a tongue tie. We had some good friends who told us about craniosacral fascial therapy, and they also told us about frenectomies and what
Yeah.
look for a good provider. So we dug in deep. I did hours of body work every day on this little girl, Serenity. She's our little tiny baby.
Ah, perfect name.
And I would do hours of body work on her organs and work on in her mouth. I just didn't, So, and when I took her to a couple other people, we ended up needing to get a laser frenectomy. It was night and day. My wife did not have the cracked, bloody nipples, and she was able to breastfeed. And Serenity was able to feed without being up with that writhing, gassy body.
Oh,
So,
yeah.
thank God for airway centered providers, pediatric dentists who know what they're doing with that, because it was revolutionary. But I will say, what I like to say is, now that was huge. But after that, I did the post-op care. Every 4 hours I would do the stretches, and then boy, bouncing on a physio ball, like arms tired. But that's when I started to discover, okay, that helped, but I still need to do like an hour of body work every day to optimize her function. So
Yeah.
for 3 months, I did about an hour of body work on her every night in order to release the visceral system, work on the floor of her mouth. And that's when I started to decode these mysteries of how the floor of the mouth connects to this really specific pattern that I see now on like 99 out of 100 patients with airway or tongue tie issues. So
That's
that's what
super
began it,
cool.
though. That was a rabbit hole.
Our children are our greatest teachers if we
Yeah,
just let them. They're our shamans for sure.
so much.
Oh, well, I want to back it up and just acknowledge the fact that you tapped into your intuition,
Mm,
which, I feel like as women, when we step into this motherhood role, if we, accept the role and responsibility, that our intuition's heightened and we utilize it, and it's our, sixth sense, seventh sense, um, but it's not that common that gentlemen talk about it or
mm,
tap into it. So I think that's really powerful. And, I just want to applaud you for that because, like you said, you've gotten all this, you've been an open pathway to God or whatever higher power you believe in to allow these downloads to come in, which is freaking cool. So good on you.
yeah,
Good on you.
yeah.
Um, oh, that's
Well,
well,
well, go
go
ahead.
ahead. No, you go ahead.
Yeah. Well, I was gonna say, my wife Dawn, I got to learn through seeing her, not just through like the um, the harder things to talk about are seeing her miscarry, and
Yeah,
seeing how incredibly painful that was, physically for her, emotionally for her, emotionally for me, and seeing how in tune with her body she was, so that she would feel things that much more. and
mhm.
and that's hard. It's hard to feel more, but I think I learned
I
from her,
know.
for sure.
Yeah,
Learned from my family, my mom, my dad too. But I from an early age, I felt like, you know, there's so much beauty in feeling more, because if we can feel the pain, we can feel the goodness and the pleasure. We can.
yeah.
So I just followed my mom and my sister around, untangled necklaces, did their nail polish. Anyways, I picked out shoes with them because I didn't have a choice. I wasn't old
Yeah,
enough to sit in the arcade at the mall, so I get to go with them everywhere. So I learned the feminine without even knowing that I was being brought into that world.
yeah,
Um, and so I'm thankful for these polarities of the feminine and the masculine, because we
yeah,
need both. And
absolutely.
intuition has been such a good guide that, because without it, I would feel like I don't know how I would feel alive if I wasn't led by,
Mm, yeah, that's great. It's like you said, it's our compass and we all have it, and it's the best freaking guide if
but
we just allow it to be. Aw. Okay, so what everybody wants to hear from you is, and maybe you can tap into a little embryology as it relates to tongue ties
yeah,
and probably what your daughter taught you a little bit. Should I just stop there and let you just go with it? But I feel somewhat that the pendulum has swung and we overdiagnose tongue ties now. And we go straight to a knife or a laser or whatever is available in the community rather than, like you mentioned, trying body work first, trying any kind of unwinding. And a lot of it, let's say there is a surgical procedure, a lot of it does not come with post op body work. And then we see it, it comes back or they're still affected in,
yeah,
not a positive way. So let's go down that rabbit hole for a minute.
We have 7 hours. Just kidding.
Yeah. Teach us everything you know in the next 15.
No, it's such a true thing. And it's like, as a parent who's had 3 little ones with tongue ties, and
Wow.
realizing I have that, looking in my brother and my sister and my dad, knowing that embryologically these things start not only with our parents, but our mom. Um,
Yeah.
the egg, your egg came from when your mom was in
Yeah.
your mom's uterus, in utero. So these things go back way further. But so I want to delve into the embryology because it is
Yes.
such a valuable thing. But I kind of wanted to go to the end of what you said because I mean I have the benefit of like collaborating with some of the most premier people in the field of airway, tongue tie, and being Dr. Zagi being one of them. And Dr. Rachel Barnhart in my city, and then so many others that I collaborate
Yeah.
with. And in their practices, what they do is they highly prioritize body work. And so
Mhm.
when they get patients, they send them to me saying, Neel, is this person ready, baby or adult? And I do pre-op assessment. And now that's what I mostly do is most of my patients are being sent to me or I see them and I find out they have these restrictions. But the people I work with are always saying, Neel, can we get away without doing this release? That's what the surgeons say to me. They prefer that
That's
because
awesome.
they know that if somebody can be really as specific and nitty gritty as I am, then we can see when it's indicated and when it isn't. And I always say, let me give you my opinion, the provider that asked me that. But I turn to the parents and I'm like, I'm just going to give you my opinion because you're the ones that decide this, whether you're the parent of a baby or a child or an older child. Or, I just had a 75-year-old who came in, referred in, and he ended up getting his tongue tie released. But if it wasn't for the body work, and I would probably go down a rabbit hole if I start talking too long about it. But if I can come back to that, but if it wasn't for the body work we did on him, it wouldn't have worked. And honestly, I think I have like the fortune of designing my practice to be a non discipline specific practice. It's a
Mhm.
transdisciplinary, multidisciplinary practice. Like anybody who wants to go check out my website and go to my Embryology Explained, I've created a 9 series where I go through the body systematically and I go through all the fascia, all the muscles, all the organs,
But
all the lymphatic system. I go through the emotions, I go through trauma, I go through environmental stressors. Then I go through the embryological early life experiences that might be influencing that. And then I go through the empathic, like when I see families come in, I see the mom carrying the stress that the baby has. And if I release, the baby, tension in the baby's body, sometimes I'll go to the mom and I'll feel that same area on that mom release and to the dad. So
makes sense.
I like to, it makes sense, right? So I
Yeah.
see the generations. When I see a grandparent, a parent, and a baby all at the same time, then I can go between them in a hour, 2 hour session. If we can get through stuff that normally they'd have to go to visit after visit after visit for. So I'm positioning myself in one essence that I have the fortune of long appointments because I've designed my practice that way,
Mm.
so that I can sift through all of this and I can take time and I can evaluate what's going on with this tongue. Why isn't it moving? Why
Yeah.
is the lip and the cheeks and my goal is to get that baby feeding or get that kid talking or whatever. Just it's really not the goal. I think it's the goal is to get their nervous systems working, get their brain working, get their brain to body talking, so they can
Yeah.
heal and heal well. But because I am a go-to provider for optimizing any airway procedure, any feeding procedure, whether it be palate expansion or jaw surgery or TMJ or tongue tie procedures, I have to really hit these points on exacting outcomes. It's because I team up with a myofunctional therapist, with the dentist or the orthodontist or the jaw surgeon or the lactation consultant or whoever's on the team,
Yeah.
and I'm one of the kind of the orchestrators of the team, so that we can say, how can we get this to be easier, freer? And so my favorite moments are when little baby comes in, the mom's like, I just think he's not doing well, he's not feeding, and he has got this really significant tongue chat, I know. And I'm like, well, my goal is to just help you. So I worked on in his mouth. I worked on this little newborn's body, and his jaw was
Oh,
so retrognathic, which I see a lot of, the platysma and the cricothyroid fascia and all
mhm.
that was pulling the jaw back. So I released this phenoid, I released this TNJ, I went to intraoral. None of that was working, but that's because this needs a
So
little bit
tired.
different kind of body work. Within 2 visits, his retrognathic jaw came forward, which enables the floor of the mouth to loosen and the tongue to elasticize. While I couldn't remove it, we cannot remove the existence of ties. That's a different collagen type 2 fascial fiber that's not the same as the collagen 1 fascial fibers that run through the rest of the body. So while we can't eliminate the tie, his mouth could move, his tongue could move, and his jaw could move, and he could nurse just
You
fine.
can function.
And that's what the baby needed, and that's what the mom wanted, and they were happy, and I was happy, and that's where it was. She's like, "We're good," and I'm like, "Thank
Awesome.
God, you're
Yeah.
good." So I love that because when that
Yeah.
can happen, I love it, and it's the most beautiful, beautiful thing.
Ah, so, okay, if anybody wanted to learn more about embryology, go to your website,
Go to
watch
the
the
website. I'll hit up one of the main points that I teach
yeah,
on this, but it's so in embryology we just look at like what happened in utero, what happened
yeah,
in gestation, and there's too much to talk about with all that, which is why I teach some of the courses on that. But the coolest fact I think is that the diaphragm starts in utero. When the diaphragm forms, it starts in our throat, and that's at 4 or 5 weeks. So at 4 or 5 weeks, starts in the throat. That's the
yeah,
same time the pharyngeal arches form, and that's the same time ties form. So all of that happens at the same time. So if we have ties, they originate at that 4 or 5 week. By the 11th or 12th week, if we have the genetic health and the exuberance and the right environmental factors, those ties can dissolve and clear.
mm,
And those are the ones of us that don't have ties. But if that doesn't happen, then they persist and continue. So they've been there since 4 or 5 weeks. But that's about the oral ties, whether it's the lip tie, upper
yeah,
lip, lower lip, upper cheeks, lower cheeks, and the tongue. But the diaphragm forms at that time in the throat, and by the 6th week, it descends to the thoracic level, T6. By the I think it's the 8th week, it descends to the lumbars, to the diaphragm where it is, to the belly. So that means it starts in the throat and it's so close to all this tissue. And then it pulls, it's like this downstream fascial pulling that starts to create this tension in the body and this torsion. Um, if I talked
oh,
about all the points of it, it would be too much. But I have defined 70 data points in the body that correspond to tongue tie, narrow
what?
palate, and it's like the pattern is almost the same on, like I said, on the thousands of
Oh,
patients that I've seen, it's like 99 out of 100 have this pattern of those 70 data points. So everything from the hyoid bone is misaligned anterior on the right. The
what?
sphenoid is misaligned to the right. The temporal bone is misaligned on the right. The zygomatic, the ethmoid, the lacrimal on the right. And then we can go all the way down to all the other points in the left, piriformis, the left glute, the left hamstring, the left soleus. It's crazy down to so down to the bones, the visceral, I've defined that and codified that all into an airway or a tongue tie map that I'm teaching in my latest course, which starts
That's
July
awesome.
17th. But I'm putting that out there, and I'm going to keep putting it out there because I want this to be available to all people who have bodies and who work on bodies. Because if
Cool.
you don't have this map, it's like that.
I don't
It's
know
a,
where to start.
you don't know where to start, and sometimes you don't know how to truly loosen that body. And
Yeah,
I get people who come in who've been to everybody, and they don't know how to make sense of how to get free. They've had 1 or 2 or 3 tongue tie releases, and they don't know why it didn't go well, or
oh,
they wondered if they should get a release, or they don't even know tongue ties exist, and
yeah,
just kinds of cases that I see are some of the most complicated. But I feel like that is healing and that is pain. And when we
yeah,
have pain, we just want answers. And so I'm not about complicating things. I'm like, let me simplify this so we can just get people free, because
yeah.
what people want is just to feel free.
The freedom. I
Yeah,
love it. Freedom in their bodies.
yeah.
So, okay, I love this stuff. The, well, nerdy question. Can you look at somebody and be like, "Okay, they got a tongue tie," now at this point in your career?
About 3 years ago, I could easily do that.
Yeah?
But when you go deeper down the rabbit hole, you ask the other questions. You're like, oh, because I have dentists who send patients in saying, there's no tongue tie, but because I know of your airway map and because I know these points, I now look for them. I need to see if there is one. So the some of the most renowned experts send the babies into me, or the adults or the kids, and I'm like, oh yeah, once you get that floor of the mouth tension to drop, and you can take away that muscular fascial compensation,
The
it may
compensation.
it may compensation, then the frenum will appear and manifest
Mm,
out of the hidden tissues of the muscle. So the reason I love this is because the dentist is like, I thought there was because they have apnea, sleep
everything.
apnea, and they
Yeah.
have ADHD, and they have da 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 da. And then and they're like, I thought it was there. But you know what? The moms who say, I thought it was there, but they've been gaslit and invalidated
Yeah.
intentionally by other people. I'm not going to name other people, right? I love MDs. My dad's an MD. He's a cardiologist. I grew up roaming the halls of the hospitals, seeing people healed and get sick all at once. And I respect my dad greatly, and I respect the medical field. But I have so many patients who have come in because their pediatrician, I don't want to,
Yeah.
people who have told them tongue ties don't exist, or
Yeah.
no. But but I've also seen the moms and the parents who've come in who have said, yeah, I went to 3 experts and 3 dentists, 3 lactation consultants, and they're all great. And I'm like, I love them. Their work is amazing. And they're like, they
Yeah.
said there was no tie. And I'm like, I know. So this is what I'm saying. Down the rabbit hole, I'm like,
It's
I
deeper.
know. This
Yeah.
is so tricky because once I released enough fascia, it made the tie more evident. And then now we can actually decide what to do with that. And
Mhm.
usually people, the patients, the babies are so much better at that point. They're like, okay, cool. Maybe we need to take care of this now, or maybe when they're 4, maybe when they're 7, maybe there's these windows.
Yeah.
Maybe when they're 75, like this guy who got free of so much tension in his body when he came in for body work, or maybe they'll never have to do it. But
Yeah.
when I look at somebody now, sure, I can see and feel all the things that they have going on, and I can see things that point to that. But a good example of this is it's so nuanced that if somebody like this one woman comes in and she's in her 30s and she has no apparent tongue, but her palate is so narrow, the roof of her mouth, that it's like a burrito or like a taco instead of a bowl. And that
Yeah.
means the tongue has no tongue space. That's what the palate is, the roof of the mouth is. It has no place to land. So functionally, that tongue doesn't want to go to the roof of the mouth. It wants to stay at the floor. So while there is no tie, her mouth thinks there's a tie, her brain thinks there's a tie,
Yeah.
so, there's a lot to say about that, but I'll say so yes and no. A few years ago, I could see every single one, but now I know how many I'm not seeing because I'm not thoroughly investigating and doing
Yeah.
body work and doing this approach to see what's going on with them.
Yeah. Okay. Well, okay, a few points here. One, I feel like I should bring my whole family, me, my husband, my baby girl out to you at some point. The and you mentioned second point, you mentioned windows of opportunity of working on kiddos. Can you elaborate on that or working on people? Like you mentioned 4 years old or are there optimal windows?
Well, I think I'll probably zoom in and then I'll zoom out just because
Yeah,
I
yeah.
love your question. Because what I lean on heavily is the collaborative work that I do with dentists and ENTs and myofunctional therapists and lactation consultants and but so the windows are about like that, optimal windows for releases, tongue tie
Yeah,
releases.
okay.
But because that's not my essence and my core of what I'm there for, I'll come back and zoom out or zoom into. Um, there's no, the best window of taking care of somebody is when that little baby is in that belly of that mom that I get to take
Yeah.
care of. So I know you know that well. So
Yeah, we're gonna
I'll
get
leave
into
that
that.
to the windows. But if I tap into the embryology, I have a background in pre and perinatal birth psychology and somatics,
Love it.
which are involved in my practice. And so one good example is there's this little girl who was having it. She just the family came in for okay. I got to say this as a disclaimer that I so balance the stressful dynamics and polarities of being an objective provider,
Mm.
because I've seen families who come in, and when that baby really needed that release, or that toddler or that kid needed a surgical release and they didn't get it, and I see them years later, I see how hard it is on that family
Ah,
and how they struggle. And then I also see how, if I am a body worker and I'm doing things and it's tightening up again, that family's like, can I just come to you a bunch and I can avoid a release? And I'm like, maybe, I don't know. But if I see the same pattern over and over and over and over again,
repeating.
that's a clue that there's a restriction that I'm not identifying. And I'll go through the empathic realm, the environmental thing. I'll go through all the stuff,
Yeah.
nervous system. I love nervous system work, um, and family nervous system work. I feel like working
Yeah.
on one nervous system is so important. But I have special appointments for family nervous system, or mom and baby, or, like I said, you bring
Yeah.
family in, because so much of the time, if we're carrying somebody else's stuff, sometimes it's not until you release that other person's stuff in the room to where there's a discernible, tangible release on other family members. But it's more about like helping that. I know you made this amazing post on the polyvagal theory and Stephen Porges, and I work with somebody who collaborates with him a lot, and
Awesome.
Continuum Movement, Donna Goels, who leads Continuum Movement. And so with all that, it can get like, okay, there's so much to consider here,
Yeah.
but it super simplifies down to, um, like the embryology is where we came from. We came from this place in utero where we were developing in the mother's womb. So I love the fact that we can work on the mom and release mom's tension, and dad's, or whoever's in the family there, to see that brings nervous system regulation and calm and settling. And that's just the best thing. This little girl, back to the girl, mom and dad brought her in. She was dealing with tons of breastfeeding issues, and
Mm.
the family's just like, we don't want to get a release. And I'm like, okay, I'm going to support you. And so within 2 visits, baby was feeding perfectly. After the,
Oh,
I'm going to skip over all the details, because for me,
yeah.
this is what I do all day. So did all the things, all the craniosacral, all the craniosacral-fascial, all the,
Yeah.
visceral work, all those things that I do just with every patient in my half an hour to an hour sessions with the babies. And um, but then it was like a few months went by, and that little girl was like, couldn't breathe through her nose, snorting, and would gasp every once in a while in the night. So the mom and dad brought her in thinking, is it from the ties? Is this going, and so when I was working on her, I do a lot of muscle testing, applied kinesiology,
Yeah.
or, and so I was testing into like what's going on in her, and I felt and tested into her mouth. I'm like, no, that's not it. Tested into her organs, and it came up right here, and then I'm like, oh, that's her esophagus or her thymus, and I went through all the the testing. It wasn't showing up then, so then I muscle tested to um, somewhere in utero in the 6th week, and that's when it showed up. So I said,
Dang.
okay, it showed up in the 6th week, and it showed up in this region, and I could say all the technical terms for all my embryology lovers out there, but let's just distill it down to, it's a vestigial organ that it, we view it now as an organ that ends in utero, but truly the cells that made us still exist in us. So even though
Yeah.
we call them different names, so what I had the parents work on releasing fascia in the chest with the intention that we're working on her at 6 weeks in utero. The next time she came in, she didn't have those breathing issues. And there was a few other layers to work on, but it was a good example of like, even though I get somebody and we're working on them in the present, sometimes you have to go back to when they
Yeah.
were in utero to access things, and you can release things then. So um,
That's cool.
that's my favorite thing, is just to find out when things happened and how can you go back there to release them at that
Yeah.
point, and then they don't have to deal with it now. That's kind of
When
what
it like literally imprints on their body.
yeah,
Like that's cool.
yeah,
Okay. Okay. So I think I was listening. I forgot where I heard you mention this, but we also let the coaches know this in our coach course that DRA, babies are born with DRA.
yeah.
And I was so glad to hear you say this. And DRA, diastasis rectus abdominis, for those of y'all listening. How does this relate to Ty's embryology going back? Because I
Uh,
definitely want you to share your wisdom here.
yeah, it's so good because yeah, you know what? It's like I mean, you're all familiar with like so much of postpartum care, and I
Yeah.
see moms, 20 years later who still have diastasis, and I work on
Yeah.
that. And the biggest connection with diastasis and with airway is that if there is diastasis, those protracted anteriorly displaced shoulders can't come back really well at all.
Mhm.
And also the mandible comes forward, the floor of the mouth tightens. So many patients who come in and they're dealing with failed tongue tie releases or breathing issues and all of that. Well, if their abs are separated, then their diaphragm can't stay aligned, their kidney can't stay aligned. Top two organs associated with tongue tie are diaphragm and right kidney. And
That's
so
wild.
it's so crazy how we can work on that ab separation just for 1, 2, or 3 sessions and see so much resolve. Their shoulders finally come back, their mouth tension release, and
Mhm.
that's helpful. But yeah, then I started to see diastasis on a lot of the babies that were born, and then I'll flip right to one case I had here in the Bay Area, which I
Yeah.
was telling you about, and it was few months ago. And this man, he's like 30 years old. They just had their first baby, he and his wife, and so he was in like the most stressed out nervous system phase of his life. He's like, I am stressed, he carried so much tension in his body. He said, my legs are so tight, incredibly tight. So he had a tongue tie release, and he had good results for 2 weeks, and then everything tightened back up. And he had bladder dysfunction, and he couldn't, have proper function with his urinary system, and just incredible tension in his body. And when I
Yeah.
felt him evaluated, I'm like, oh boy, yeah, you do. You're one of the tightest people that I've seen, and I've seen the tightest of the tightest because I get people sent to me that other people can't unwind fascially or myofascially. And so pretty quickly, I felt the diastasis. Wow,
Wow.
his abs had like 2-inch separation, almost all the way from his xiphoid process
And
to
a gentleman, y'all, and a guy.
the guy, right? Because every baby has ab separation diastasis when they're born, and through tummy time and integration, most
Yeah.
of those babies integrate that.
Yeah.
Ones that don't, babies are born male or female, right?
Yeah.
So I've seen enough men with diastasis that it's, and so not only that, but because of the diastasis, he had a double kidney misalignment. Both of his kidneys were so anteriorly misaligned, and I worked on both kidneys and abs. When I finally did, the amount of rigidity on his pelvic floor, I don't check internally. That I leave
Yeah.
that to the pelvic floor therapists, but his glutes, his piriformis, his hamstrings, his adductors, his psoas muscles, his abdominal muscles, his quads, and all that went from level 10 tight to within like 2 visits level like 4 tight.
That's
And
awesome.
he finally felt for the first time in his life, like, and he'd been to everybody out there, right? So I just so many people. He felt finally a reprieve of his nervous system, even though he said he felt looser and he felt an improvement in all the other functionalities. That for him, it's like he just wasn't living on edge all the time. So that diastasis, addressing that was the key, because I could have adjusted his kidneys all day long, like I do every day. I adjust at least, if I have 10 patients, I adjust 8 kidneys. That's what I do every day. So if like if I were to just adjust his kidneys over and over and over, no way, or adjust his atlas or whatever it is, it
Yeah.
was that diastasis that needed to get integrated in order for him to heal.
Wow. Okay, so I don't know if you have anything for, let's say our coaches are listening, BirthFit coaches, and they're very well versed in developmental kinesiology, and we've developed the BirthFit basics, which are 15 movements and poses based on developmental kinesiology.
Yeah,
So that's what we do in the immediate postpartum to help integrate mom just as baby's integrating.
yeah,
So like taking a cue from baby. But let's say they have somebody that comes into their class that, is 2 years postpartum. I think the oldest has probably been 5 or 7 years postpartum. I'm thinking of somebody that came to me 7 years postpartum, and still, huge, significant diastasis, more than 3 fingers. Um, is there anything besides taking your course and learning the
Right.
things,
Yeah, yeah.
but is there any like pearls of wisdom you can leave with, a coach or a leader that's listening and, they're just on the floor with them in the gym trying to figure things out? Do you have
Yeah.
anything for that?
Yeah, it's so good what you all do. I know because I know Michaela Spears here in Reading.
Yeah,
She,
she's awesome.
trained with y'all, and then she's got FemFit.
Yeah.
And so we were talking about it, and I've seen what you do, and I do similar, not as robust, but I do some similar things when I teach parents how to do body work
Mm,
with babies. I always get the parents crawling and doing
you
tummy time,
have to. Yeah.
right? So, but I would say I'll go to the really like nuanced, tricky things because I feel like those are the gems that would help you all
Yeah,
because
yeah.
like your coaches are just kind of like really in this. You're seeing a lot of this. You're seeing what helps. But what I'll say is that if the sphenoid is this bone right here that sits behind a lot of the other cranials, and with most people that have diastasis, the sphenoid is anteroflexed. To
Mhm.
exaggerate this, I had this. This
Yeah, a little model.
pediatric dentist happened to have this in her cupboard, so I found it. So it's like the best. So the sphenoid sits here behind all this. It's that red bone, right? And so the
Mhm.
anteroflexion looks like
Like,
it looks like this or like
yeah.
this, but it's pivoted specifically at the sphenoid. So what that does is that if it doesn't get extended at the joint of the sphenoid, then it doesn't allow for the body to go out of that contraction. So one of the simplest ways to feel this is, when you rub your temples, and your
Mhm.
coaches can have them rub their own temples. But then if you take your fingers and you make kind of you push in with your thumbs and you hold here so that you can get a pivot point, then you
Yeah.
can pull the fascia of your head back while you're pushing your thumbs forward. And that's how you get your sphenoid into extension. And we're using the temporal bone, but if you go a little bit behind there, that's the sphenoid. So if you go there, you get your sphenoid in extension. Yeah, exactly.
You're really going, "Shh."
You're going like
Well, watch
this.
the YouTube video.
Yeah, and if that feels relieving to you, you need it,
Yeah.
because most of us are in, especially with diastasis, we're in this. We've got that
Mm,
furrowed brow. So if you're like this, and if you go like that to any of your clients' patients, or you have them do that, that is really amazing. And not only
yeah.
because it allows the front body to extend, um, but also under a functional MRI, if you look at the sphenoid and you see it moving, you can see the exact same thing happen in the pelvis. They're synchronous
Right.
in their
Yeah.
function, and that's an osteopathic discovery that was made way long ago. So we can see that sometimes the pelvis needs the upper cervicals to release, but the sphenoid specifically is a cranial that often needs to loosen up a little bit. So
Mhm.
to do that move could help. The other one that can really help, and this is maybe more common knowledge, is that the abs insert into the pubic bone, and of course the adductors, most of them insert into the pubic bone, and the
Yeah.
adductors, most of them end in the knee or right above the calf muscle.
Yeah.
So often we can see that knee issues or inner thigh muscle tension. You can even go a little further down to those feet that invert due to ankle sprain or anything like that. If you work on the kinetic chain and you get those ankles loosened and move them around, and maybe stretch them out a little bit, stretch out those calf muscles, stretch out the inner thigh muscles. I mean, definitely, I do a lot of really in-depth body work on those adductors, because if I call them the floor to the pelvic floor,
Yeah.
and the pelvic floor is like the core and the basis of whether that
Yeah.
diastasis is going to function. So sometimes it's that lower adductor attachment that won't let go, and when you let it go, there's suppleness, and then the pelvic floor can settle in. And then I'll go to my last point, which is the floor of the mouth.
Yeah.
Definitely, if you
That's
work
cool.
on a little bit in the floor of the mouth, that can often loosen the adductors, which will finally let the pubic bone move well, which will finally let the abs move well and integrate. So
That's
those are my
cool. Yeah, they could, I mean, if they're a coach or a leader listening, they could totally, in the savasana or laying on, they could go around and give
yeah,
a little assist or, you know, obviously with the client's permission,
definitely.
go from there.
Yeah.
That's super cool. Um, so you mentioned the pelvic floor. What is your take with pelvic floor dysfunction? And I mean, things along the line of like urinary incontinence and prolapse.
Yeah. I mean, there's boy. I mean, I'm so thankful that I get to collaborate with a pelvic floor therapist who's phenomenal. So
Yeah,
and she's taken my tongue tie classes.
amazing.
So because of that rabbit hole, because she had a baby who had a tongue tie, and things weren't working even after the release. So she was seeing basically somebody else, and it wasn't helping. So that led her down the rabbit hole. I love that because um, I get to focus on what I focus on, and then let
Yes.
her focus on what she focuses on, which of course is the internal examination. But yeah, with pelvic floor dysfunction and prolapse, well, I just would say that's so hard. Like, I have such respect for what you all as women do with birthing babies, with postpartum. It is like, my wife has 3 kids. We have 3 kids. She birthed 3 kids. She birthed 3 babies, and to see like how much your bodies have to rearrange and how much you have the miraculous expansion. And yeah, relaxin does a lot, but it doesn't do, it doesn't make it
It's
easier.
like a small fraction of the whole puzzle.
Small fraction. So to see the postpartum journey on a lot of moms that I take care of is hard. And I feel like, while I get to help, and there's some keys on how I help, I also I feel like I would be glossing over and invalidating the struggle of that whole thing if I didn't talk more about that, because it's a hard journey. And I think it's like one of these sacrifices you all make is you birth babies, and then you go through so much. And some moms have a beautiful, that postpartum journey is like relatively easy for them, they say, and then I see some, and it's like, oh my gosh, and there's BirthFit, right? I recommend
Yeah,
BirthFit for all these
totally.
moms who,
Well, I was just thinking how grateful I am to have had the decade of knowledge before.
yeah,
Like,
yeah,
as just listening to you talk right now, like, I think I didn't have DRA because of all
yeah,
the movement practices I did before, and I would do cranial sacral, once a month.
yeah,
And I rested postpartum, I made sure to have a lying in period and, just the practices that we preach at BirthFit. But, you know, as somebody, there's people out there that don't have access. Somebody put it over here. Michaela has a dream team, Dr. Neel, and a pelvic floor PT in the area.
yeah,
Um, but somebody that doesn't have access to people like you or chiropractor, pelvic floor PT, for those that don't know, when I gave birth, we were living like an hour outside of Austin. So to get anybody to come to our house was, an extra couple $100.
right,
But it's there's so much you can do to prepare, I think, and on your own. And that's what I want to get across with people is like, we have the tools inside of us innately, like you were talking about in the beginning with the intuition. If we just open up to it and listen to our bodies, listen to our God, listen to our babies, it'll come, which is super cool. I don't know if that resonates or makes you think of anything, but that I
no,
was
yeah,
just so grateful for the decade of information that I have, and now I'm like, oh my God, I want to learn some more.
yeah. That's why I am so thankful for what you all do. I'm so thankful for Michaela. And whenever I send people or like refer people to Michaela, or they tell me they go to FemFit, I'm like, oh, thank God, that's so amazing. Or
That's what we hear more and more.
people,
Yeah,
yeah, I'm like, okay, good. Or we have such a good network in our area, or even in the Bay Area and LA. That, like, we are fortunate to have a lot of good resources. But
yeah,
then I get the people who come in and they're like, we've never heard of any of this. We
I
were
know.
just, we had a baby, and our lactation consultant at the hospital said, go see Neel. They're not allowed, there's gag orders that some lactation consultants get when
Yeah,
they're more
yeah.
mature, they can't talk about it. They now just say, go see Neel. And that's code. So
That's
so
the code to go.
oh, right. And then so I see the babies, and then I'm like, oh my gosh, they've never been through holistic or
Yeah,
natural preparation. So yeah, I see the crunchy, like us, like the
yeah,
granola moms in the families who have been through, man, they, midwife after midwife, and the midwife gave birth to, yeah,
yeah,
them birth and their parents. But then I see the people who have no resources whatsoever. And I'm like, I wish I could go back in time, but at least now
yeah,
and now you know who to talk to about it. So to work with them, that's the challenge
yeah,
because, like I said, I get caught up in the grief or like the pain of what they're going through. But then when we get that whole system, from the floor of the mouth to the diaphragm to the diastasis to the pelvic floor to the adductors to the feet, touching the floor
yeah.
correctly, widen those toes, get them that
Mm,
toe splay, adjust the talus, free the big toe, free the plantar fascia, just whatever needs to happen. And often what I see with a lot of these is that kidney is misaligned or that colon is constricted or all the things with the visceral work is
yeah,
whether so the and a lot of those moms, not every mom, but a lot of the moms who where baby was stuck and couldn't get to
the
the optimal
sin.
positioning, most of them I find a right kidney misalignment that needs to be released so that baby will flip, or if they don't flip, I love Webster's
Yeah,
and thank God for that, but I also do external cephalic manipulation. It's
yeah,
a osteopathic maneuver. So if baby's not turning after we do all the things within chiropractic, then I do all the myofascial and then I do all the osteopathic, and then if it feels good and we intuit and that we know that that spinal cord is not in a position or placenta previa is not existing, we could flip, usually flip that
yeah,
baby. But with that postpartum care, I think homeopathic care is so amazingly helpful
yeah.
for these moms. And I think dealing with that inflammation and like what I think I see with a lot of prolapse is histamine intolerance, which could be
Mm,
from mast cell issues. And the cool thing about that is, I always hear whenever I talk about too many details like that, I think of Tony Ebel's posts with PDX, and I'm like, okay, he's like, I love his stuff because he's like nervous system, right? If you try this whole list of things and you're getting complicated, get simple.
keep
But
it simple.
I love that because a lot of moms will vet out, they'll dig through and they'll find what works for their little one or for themselves. And so I love that homeopathic care is so simple because it's
Hmm.
distilled, diluted,
Yeah,
frequency medicine that's like in these easy tablets to take. And so I think like that inflammation and giving that mom some minerals,
mm,
fulvic and
yeah,
humic acid, but also doing that body work. They need that tissue work. They need some of that.
yeah.
Getting into the fibers of fascia. And that's what I love to do is to see what is all not situated correctly, where I can get to it to help free up that system of tension so we can get balance and integration and so that their bodies can work the way they were designed.
Love it. Oh, it's good
Yeah.
stuff. Okay, so there's one thing I was going to ask you, but it'll come back to me. Actually, I want to go down two things, but for your course, let's talk about your course this a minute because I want to know who's this for? Can anybody take it?
Yeah.
There's some people out there who have financial obstacles. Would this be a good course for them? Um, yeah, who's this geared towards, and when and how can they sign up?
Okay. Well, the Floor of the Mouth Interconnectivity Unveiled is the 6-week course that starts July 17th, and it's live Zoom, 90-minute sessions, and it's going to have a lot of resources packed into it. And yes, it is $600, but it's for your audience, $560, and who it's geared towards is providers, practitioners, coaches, teachers, instructors, because it's about guiding. I'm really going to cater it towards how can you guide others in
Mm,
healing. And what I teach with it is not just the really, I think avant-garde forerunning airway and feeding knowledge about the tongue tie and airway, but it's more about the floor of the mouth and how tense that is and how connected to the diaphragm and the floor and the pelvic floor, and how,
Mhm.
of course, we know the fascia goes from the tongue to the feet, but it goes, taller and lower than that. So I get into the nitty gritty of all of that. And then I also talk about, gear this towards myofunctional therapists who are working with,
Oh,
you know, people before and after releases, but as well lactation consultants, IBCLCs. I've had a lot of them take my classes before.
cool.
So this is for them. This is for you if you're a PT, if you're a DC, a DO, if you're even I have dentists taking it because it's how they can know how to manage these cases and to be the coordinator of care for these. And then if you are even if you're a nurse practitioner or you're a massage therapist, a lot of craniosacral. A lot of people take the CFT, the
Yeah,
craniosacrofacial therapy, and they want to know how to go deeper into airway. So I usually have people refer to me for that. So
that's cool.
while this is not about all of that, it is about the centrality of the floor of the mouth and how it connects to these 70 data points in the body, and how, so I'm going to decode that map. And I'm also going to teach people how you can identify on how to, improve function. So like if you have somebody and you're wondering how to loosen up their bodies, and you wonder if they have airway issues, tongue tie, just how to look for that, and how to look for things like that 75-year-old patient who had his mouth wouldn't loosen and his TMJ wouldn't let go. How to help him by I had to take out his hearing aids. When I finally
Mm.
took out his hearing aids, his mouth loosened and his floor of the mouth
Ah,
dropped, and then his ear, his temporal bone could adjust. Revolutionary light sensitivities, how to detect for when patients have light sensitivities that are affecting their fascial tension. And the
mm.
other one I'll mention, she's had her baby 4 years ago. She had diastasis. She had a tongue tie release. It didn't go well because that diastasis was there. So I'll teach you all how to understand how diastasis and floor of the mouth tension coexist. But also with her, the most challenging thing was that I had to work on her side lying in order for her floor of the mouth tension to decrease. And I had to adjust her thyroid and her parathyroid gland. Then her excruciating headaches and neck pain that were there for her whole life finally went away. So, so I teach people how to think through that in a systems thinking way. But I
Yeah,
say it's also for parents who, because you could spend $560 on this class and save thousands of dollars on care. Because if
yeah,
you know what to look for, and you have 2 kids, 3 kids, 4 kids, 5 kids, right? You're going to spend so much money on going to people who don't know this. Not at all knocking you all out there, because I want everybody to have this map, but you save a lot of money by finding out that you can decode things that would help you know what you need and how to problem
what
solve
to
it,
look for.
what to look for. So I really get excited because that's why I'm pushing this out there, is I just want to spread it so it can give people the keys and agency, because it says that you have the agency to know what you need to do, but also to know, if you're a provider, you'll know what's in your scope and when you need that other person. I don't
Right.
do anything with fascia. I need the myofascial, person, or I don't do anything with organs. I need somebody who's trained at the Barral Institute, or I need SOT, or I need, PDX, or I need Lindsay Cantu, So people will know, you'll know more about what you know. You don't know what you don't know until you know it.
Yeah,
So
yeah,
this is that course on, like, you're going to know so much that you'll be like, oh my gosh, mind is blown, overwhelmed. But that's why the recordings will be available till the end of the year, and you'll have
that's cool.
PDFs. And so people can digest it after the course, and they can obviously interact with me throughout the course. And I'll mention also they'll get a year subscription to my Substack newsletter, so they can have a year's. Oh, they'll also get tongue press. So I'll just mention this briefly because tongue press is my other course, and tongue press is a self-guided course. And the cool thing about it is it teaches people how to free their own tongues and their mouths, how to unwind their neck, and how to
Yeah,
do that. If there's an 8.5 video, that's a daily routine, and you get to look at that whole routine. And you guys have access to that, Lindsay, so you can all check all that out. And so you can check that out. It's in the links that you have in your email. And so
great.
you can check it out. So tongue press is for anybody with a tongue. So if you're not a provider, you're not a practitioner, and you want your patients to have a resource as well, this is for them, because they get this course. It's $63 for your people. And in that course, you can learn how to free your tongue, and it's really beautiful. But the two are very different in what they do. But if you keep
Okay.
the floor of the mouth interconnectivity unveiled, you'll get tongue press with it complimentary. So
Awesome. I love it. Okay. Now that I know about your course and you mentioned you don't know what you don't know. Yes, this has been I just want to take courses the rest of my life. Like um so I geek out on a lot of preconception fertility stuff. So this was my question earlier. It came back to me talking about visceral manipulation because I do a lot of abdominal work.
yeah.
Um, what have you crossed have any cool fertility cases or yeah.
Yeah. Yeah, two were coming to me this morning when I was thinking about you and thinking about this time that we had together. Yeah, it's so funny. I was getting situated in this condo. This is again a pediatric dentist I collaborate with in the Bay Area. She was gracious to open her home to me, and while she's working, so I was walking up the stairs and I was thinking, oh yeah, those two cases, I got to talk about them just because they came to mind. Interestingly enough, these two moms, who are now moms when they didn't know they could be, they came in when they were struggling, couldn't get pregnant. Uh, that was a problem. One for years, and the other one for a year.
Okay.
The common link is they both were under an extraordinary amount of stress. Working for the same person who I knew, so small town, but but the common link was they were coming in and we were doing body work. But on one of them, actually I did hormone testing and I found, okay, that number's off. So
Yeah.
I'm like, what do you do with that? There's so much we could do with that. So
It's so much.
I had her bring in everything that she put on her skin and everything that she put, like any supplement that she took and any skincare product. In about 15 minutes, I muscle tested everything. I
Dang.
found the two ingredients out of all of them that were problems. And I had her cut those two ingredients out and whatever other products that had that in there. Within 2 months, she was pregnant. And
Dang.
then
Do you remember what ingredient it was for her?
it was no, you know what? Right off the top of my head, I can't remember it.
That's okay.
I'll have to look. You know what? She's in Texas. She moved to Woodland Hills, so crazily. But it was oh boy, I can't remember it. So I'll
But
have to
it
look
just
it up.
shows the importance of what you put in and on your body
Totally.
matters.
Totally. Yeah, and I mean, there's a lot of other cases where um, body work was an integral part of that,
Yeah.
adjusting, getting that nervous system freed up through cranial work and visceral work. And in one in particular, her body was so tight. She was so restricted. There was just, her lymphatic system was so clogged. And whenever you work on fascia, it dumps toxins into the lymphatic system. So if the lymphatic system isn't cleared, then all the fascia work in the world won't help. So
Yeah.
we had to release the visceral system because that carries a lot of the lymph. So in her particular area, it was the colon, the large intestine. The large intestine has tons of lymphatic, correlates. And
Yeah.
the other place on her that was clearly so restricted were her clavicles. Both of her collarbones were so frozen, and the clavicles are a huge place for lymphatic congestion. There's always also, axillary and
Yeah.
some of those areas, of course, and so much to say about the glial cells that make the the glymphatic system of the head. But for her, it was getting the clavicles freed up and getting her colon freed up. And I know that was a big part of her ability to conceive. But you know what?
That's cool.
Pretty soon into the journey with her, it came up through one of those places where I was asking into. I'm like, you're carrying so much tension here. And she had this look on her face that it was so much pain, and I was barely touching that area of her
Mm.
body.
Yeah,
And
because that work is super soft.
yeah, I'm like, what's going on there? And she said, um, and I said, you're just in a lot of pain. And she's like, yeah. And I started to get an image of her in a lack of feeling supported. So I asked her, are you feeling a lack of support right now? And she said, yes.
Oh.
Because she just had her baby. And I dug a little deeper, and I'm like, was it around when you were like, 3 or 4 weeks, or, I don't know, first month of life? And she's like, well, I didn't have I didn't have a dad and I never knew him. And
Oh,
so what came up in counseling just this last week, she said, is that I realized I have a lot of abandonment issues from that period in the first month of life.
oh,
So I said, okay, well, that's what I was picking up. So let's go there for a moment and let's talk about it for like 10 seconds, right? So we
yeah,
talked about it, and I linked that area of trauma to the area of her body. And in an instant, that pain level was gone, and her lymphatic system opened up, and in that case, her body freed up in that area. And it just shows the importance of, like, whenever I see a patient in a lot of pain, I used to think it was just a sensitive area of their body, but you think fight,
dig
flight,
deeper.
right?
Yeah,
Right? So I'm like, what else is going on there? And if I can do anything to free up that tension, whether it's a 10-second conversation or a 2-minute conversation or longer if they want that, then you can see, wow, that pain was not coming from their bodies. That was coming from their emotions. So
yeah.
that's what, a lot of people come in for emotional work, even though that's not what I specialize in. They come in for that, but I just say, you know what? I don't know if that's what's going on with you, but I'm just going to give space so that if you need to talk about it, you can, and let's at least explore that and see what happens.
That's super cool. And it shows that, there's not a one size fits all, or there's oftentimes, like in my work, and I feel like this just solidifies it even more, that, there's not going to be one supplement to get you pregnant, or one adjustment, or one, like, if there's, obstacles in your fertility journey and it's been, a year or 2 years or 4 years, it's, you got to dig into those emotions and go deeper. And you're probably checking all the boxes, like most women do the hard work of, taking the supplements, exercising, doing the things. At least that's what I've seen. And then they're like, I don't know why I'm getting pregnant. It's like, okay, let's check out the layers underneath.
I
But
know. I feel like we need to. Yeah, I don't know. I'll have to plan a trip there. We hang out and we just see people
I
together.
know,
Like,
because okay, so, well, people in the birthfoot world know this. I took off of practice
yeah.
to do mom life, which I'm loving. So I'm like, literally, as I sit here, I'm reimagining the way that I show up in practice again. And I'm like, okay, this is kind of cool. Maybe it's just all preconception stuff. Or,
Mm.
I'm like, I have to learn from Dr. Neel before I go back. And so my wheels are definitely turning.
Yeah. Well, and there's like my journey with pre and perinatal birth psychology began in 2015 before we had our first child, Serenity.
Wow.
And I started a movement practice out of downloads. I would be in intuitive movement for 1 to 4 hours every morning from like 3 or 4 a.m. before we had kids, right? Because then I was on
I was
like,
gonna say, yeah, that's
so,
happened to me before kiddos.
yeah. And so I would go into this realm of movement, and I would feel emotions free. And, I, without even knowing it, I was doing movements to free the back of the floor of my mouth. And I was, crazy body transformation and emotional transformation that I encountered in that year, which led to the birth of a movement practice that I created. And in that, I have a movement that I created called embryo, and it simulates the embryonic movements that
Yeah.
go in and out of contraction and expansion. And I've led workshops, in the States. I used to teach at a gym here or back in Reading. And then I taught workshops in Washington State, and then I taught in Israel, Singapore, and New Zealand. And I remember when I was teaching this workshop in Washington, and I had everybody get into embryo. I think it was like 100 people that I was teaching at that moment. I had them go into intuitive movement that taught them how to unwind their fascial patterns and emotions, and so they all went into embryo and they came out of it. And I had like 3 people come up to me after that, and they said, "We just went, and I just saw everything that happened when I was born, like in
Oh,
utero, and then I saw the struggle my mom was going through." And well, anyways, they're like, "Is that okay? Was that supposed to happen?" I'm like, "Nothing's supposed to happen," but yeah, that, like, I created a safe
open
space
to whatever.
so that anything that happens, just know this is a safe space and
Yeah.
you can share. And so that's what started me on that pathway back in 2017, 18, 19. And then I laid it down for a while. But then the way I came back to it was, I don't know, it was like 6 months ago. I felt led to start a podcast called Embryology. And so on there, if people go to it, they'll see there's some of the pioneers and the leaders of the field, the experts of the world in pre and perinatal birth psychologies and early life experiences, and going back to those moments and ushering other people into it. So there's a wealth of information there, and I've had such amazing conversations with those people. I have learned so much, and then I've also seen a kindred nature with that. And I'm like, you know what? I didn't come into the work like they did, but I feel like this is a part of who I am. And so I think it's out there as a wealth. So if anybody wants to check it out, it's Embryology. But it's okay. So Embryology is spelled with a J-I at the end because that's a nod to my Indian heritage. With my kids, we say Dadaji and Dadima is how you refer to grandfather and grandma. Dadaji is where there's a J-I at the end. So embryology is about honoring the embryo, but it's also about honoring the mom.
Cool.
The mom who birthed the baby and the dad who was part of it too. And so, but also, I don't know, anybody who went to Palmer Chiropractic College, you know Dr. Bhatti. Dr. Bhatti was this 90-year-old Indian Pakistani man. And I'm like, oh yeah, you're like, because my parents are from India, he's Pakistani. So we were in his class the first day or two of class. He says this running joke that he said to everybody. He says, everybody's wondering where I'm from. Everybody's wondering where I'm from. And he said, I'm from the old country. And then he would pause, pregnant pause, pardon the pun. And he would say, Toledo, Ohio. Everybody would crack up. But this man he would show us how youthful he was. He would get his legs and basically do a quad stretch. And so he would crawl around the room on his kneecaps. And that's how at 90 years old, he showed me that's what it looks like to be young. So when I think he was my embryology professor, that's why I brought that up. So when I think of embryology, I think a 90-year-old Indian man, like a kid. And then I think of, my heritage. And so it's a great resource, but also I just think like you're like, as a mom who's had babies and as the BIRTHFIT, founder, and as like this person, it's like, you carry such a sacred space. You hold space for so many women and dads. And I've just known of the people who have come across your work. And I just feel like that's invaluable. So
thank you.
Yeah. I mean, I don't know. I think that if you already do this, but yeah, I think that there's so much to creating a container for people to where they can feel their needs met with a nervous system rich focus that has emotional intelligence and body intelligence, kinesthetic intelligence. Anyways, I think you could have I see how much fun you have, and I think it'd be so cool to see what you'll do.
Well, thank you. I really appreciate that. All right. Oh, we could keep going, like you said, for 7 hours.
Yeah.
But, my mom, Gigi, grandma, she might run out of things to do with little Vera. But I know I want to definitely meet you in person and learn from you. But we touched on your course. We touched on, what was the course called?
Floor of the Mouth, Interconnectivity Unveiled.
Okay. Super long title, but Floor of the Mouth. Go for it.
Or FOM. My VA, she says FOM, the FOM course. And I'm like, that's what it is, the FOM course.
And then we got Tongue Press is another option. Yeah. We got the podcast that's available on YouTube and iTunes.
Yeah.
Everywhere. Okay. Yep. And then they can find you on Instagram.
Yeah. If you go to IG, if you go to Instagram and it's all there. If you check out my links in bio, I've got links to everything. My website talks about my 9 series of body work that I do. Yeah. Right now I don't travel interstate to do it, but what I do, I'll just mention this because I don't know if this is anybody in your world, but you have some people in LA. I've talked to BabeFit in SoCal before. Yeah. What I do for people in California is, because I work now in the Bay Area in LA, if people come to California, I do the 9 series. in either a 2-day format, or I do it in a, if some people want to do a 9-month container and they come out 3 times. Anyways, I do. It's all
That's
on the
cool.
website. I do a lot of curated body work that goes into life transformation, and we go way past the physical and into like whole life, whole body transformation. And so I have a lot of things that I'm excited about. And my most, I think, exciting thing right now is that I just love that I get to collaborate and hang out with people like you. And then seeing my wife Dawn, she's working on her PhD that
Mm.
with the energetics of healthy emotional validation, and she's brilliant. So check out her page at Dawn Bulchandani. She's the mom who birthed our 3 kids. With our third, we moved to a new house and we had 2.5 acres. That's where we live now. And we were meeting with the midwife, the one who helped us with their first 2 kids. And so Zephyr is our third. Cypress is our middle one. Zephyr's our third. And with Zephyr, we're like, okay. And my wife's like, I just feel like I need to birth outside. And I'm like, okay.
Yes, that's what I said.
Only reason that I was catching myself is because we have an Airbnb on our property. And so I'm like, if we have a guest and you're birthing out there, what? So the crazy thing is they canceled from out of town and they paid us for the stay because they canceled last minute. And I'm like, perfect. So in a birth pool in the yard, my wife gave birth to our third because she's so in tune with her body and her intuition. And she's like, I just know I need to. So I feel
That's
like
what I did with Vera. I was like, I just know I got to be outside.
you were outside for the birth.
We were on our back porch.
Oh my gosh, that's amazing. Well, look at you. That I
It's
give you,
wild.
yeah, that's
So
awesome.
tell your wife, I feel her.
Yeah, that's cool. Well, you 2 got to meet too, so that'd be
I
awesome.
know. She sounds like a queen, so
Yes.
love it. All right, so hopefully we hit all 3 things that you wanted to hit on, which was intuition, interconnectivity, and you talked about this in the beginning, like growing up with females, having that feminine,
Yes.
masculine energy balance. But do
Yeah.
you want to leave the audience with anything else there?
Yeah. Yeah. I mean, like I said, if we have like 6 more, I'm just kidding. Well, so this, I'll start with saying that I was trying to figure out how to define my field, and I got advice from a renowned person to say, call yourself, an integrative airway chiropractor. I'm like, yeah, I like that. But then I'm like, you know what? I'm leaving something out. I'm like, no, I need to call myself an integrative airway and feeding chiropractor,
Mm,
because feeding is how babies experience pain when they come in if they have feeding issues, and so do the moms. And
yeah.
if we don't talk about feeding, we are negating the feminine experience. And also, I think I love this airway field, but we got a lot of linear male kind of protocols with like widen this and stretch this. I'm not saying I'm not for that. I'm all for that. But we need to be in tune with like how can we sync up our emotions, and that's a feminine energy, and I feel like we need that. So I think that one of my greatest like hopes and my desires when moms come in and babies come in and like I get to care for these is that I just want to be somebody who says, you matter, your voice matters, and whether you've been gaslit or invalidated, um, that if we're not listening to you as a mother with your intuition, for not only for me as a husband listening to my wife, but listening to the patients that I have, and that men too, like your bodies, and but I think men are told enough, your bodies, right? Men are told everything, you're good. Women are told, you know what, you need to learn a little. And I'm like, no, we need to learn from you. So I feel like we need to sit under the feet of intuition, but also learn from women who have cultivated this over generations.
Mm,
And so I feel like I've learned from that, and I want to give the credit to my mom, my sister, my wife, and all the women who I've come across as like, look, we need to flow with this, because if we can, then not only can we learn a lot more about ourselves, but we can learn a lot more about interdependence, interconnectivity, the ebb and flow of the cycles of the month, and the ebb and flow of the ocean, and how all these things are cyclical and rhythmic. And so for me, I feel like the emotions and the flowy is, I house that in an infrastructure of strength and protocol. But if I was all protocol and no flow, I would be stuck and I would not know
Yeah.
how to get really fluid with a moment and improvise. So just to end it by saying, um, I give all the credit to those people out there who have paved the way for us, and the midwife who told me about tongue ties and that they existed, and my wife who was dealing with that, and then my daughter who taught
Yeah.
me body work. These are three of the best teachers I've had, and I give them mad credit and respect and props. And so I think that that's why I'm a birth worker, right? So I'm like a
Love
body
it.
worker, and I always want to say I'm a birth worker. I'm not a
Yeah.
doula, I'm not a midwife, no way. But if I wasn't in the birth field like that, I would feel like I wasn't doing part of what I was
Totally.
called to do.
Love it. This has been such a joy to have you on.
It's so
I
great.
know this is just the beginning of
Yep.
our relationship. Thank you so much. Y'all go check Dr. Neel out, start on Instagram, go to his website, do all the things. And we'll definitely link up to your course in our newsletter and put it in our coaches course and everywhere we can put links. But I so appreciate you, and I appreciate the work you do. I know it's amazing work, and anybody that gets to see you is super fortunate. So I know the people that are going to take the course are going to walk away with invaluable information. So thank you.
You're so welcome. Pleasure to be with you. And I can't wait till the next time.
Yes. All right, y'all. Till next time, don't forget, which I forgot earlier to announce, our podcast is brought to you by our nonprofit. So go check it out, nonprofit.birthfit.com. Make a donation if you can. We do our best to provide some birth support, doula support, postpartum doula support to those in the military. But I'll leave it at that. Thank you so much, Dr. Neel. It's been a joy. All right, y'all. Adios.
Thank you.